We understand that high blood pressure is harmful to many people, which is why we administer medications to try to lower it. General guidelines state that adults should have a blood pressure of 120 to 80 millimeters of mercury. However, these values are the same for older individuals. As we age, the risk of developing high blood pressure increases. High blood pressure is also hereditary, but even if you don't have it, if you live long enough, you can develop it. If you are over 65 and have high blood pressure, you might be taking medications and wondering what your target blood pressure should be. In this video, we will discuss the ideal blood pressure value for older adults, as well as the balance between the benefits of lowering blood pressure and the associated risks. Like this video and subscribe to our channel for more health information. What is blood pressure and why is it important? Before diving into the standards, let's define what blood pressure is and why it is so important. Blood pressure is simply the force that blood exerts on the walls of the arteries when the heart pumps blood throughout the body. The upper number, or systolic pressure, represents the pressure that blood exerts on the artery walls when the heart contracts. The lower number, or diastolic pressure, measures the pressure in the arteries between heartbeats when the heart is at rest. High blood pressure can exert pressure on the arteries, heart, brain, and other organs. Over time, this increases the likelihood of heart attacks, strokes, kidney failure, and other catastrophic problems. Therefore, most doctors place great importance on maintaining blood pressure within normal limits. ACC/AHA 2017 Guidelines. In 2017, the American College of Cardiology, ACC, and the American Heart Association, AHA, published new guidelines for the diagnosis and treatment of hypertension, significantly revising previous standards. These guidelines lowered the threshold for diagnosing hypertension, classifying a blood pressure of 130 over 80 millimeters of mercury or higher as high blood pressure in all individuals. Previously, the limit was 140 over 90 millimeters of mercury for people under 65 and 150 over 80 for those over 65. The new standards describe normal blood pressure as less than 120 over 80 millimeters of mercury. High blood pressure is defined as a systolic pressure between 120 and 129 millimeters of mercury and a diastolic pressure below 80 millimeters of mercury. Stage 1 hypertension is when systolic pressure is between 130 and 139 millimeters of mercury and diastolic pressure is between 80 and 89 millimeters of mercury. Stage 2 hypertension is defined as a systolic pressure of 140 millimeters of mercury or higher or a diastolic pressure of 90 millimeters of mercury or higher. Therefore, if you are an older adult, the new limit of 130 over 80 may affect your classification. A systolic value of 140, previously considered acceptable if you were over 65, may now be classified as stage 1 or 2 hypertension. This is a significant change. High blood pressure in older adults. Natural changes. Older adults often ask, isn't it normal for my blood pressure to increase as I age? The short answer is yes. It is normal for blood pressure to increase with age due to factors such as arterial stiffness. As we age, blood vessels lose flexibility and become rigid. Hormonal changes can affect heart and artery function. Aging can lead to a decrease in kidney function, which is crucial for blood pressure control. Due to these natural changes, many doctors hesitate to aggressively lower an elderly patient's blood pressure. The main concern is the risk of hypotension, low blood pressure, which can cause dizziness, fainting, falls, confusion, and an increased risk of kidney problems. SPRINT study. Key findings. The SPRINT, Systolic Blood Pressure Intervention Trial, study, published in 2015, marked a turning point in efforts to achieve stricter blood pressure guidelines. The study included 9,300 individuals aged 50 or older who were at high risk of cardiovascular disease but did not have diabetes, dementia, or a history of strokes. The average age was around 68. Participants were divided into two groups: a standard treatment group with a systolic target of 140 millimeters of mercury and an intensive treatment group with a systolic target below 120 millimeters of mercury. Over 3 years, researchers monitored side effects, chronic diseases, heart problems, and mortality rates. Here's what they found. The conventional treatment group experienced a 2.19% rate of significant cardiovascular problems per year, while the intensive treatment group experienced a 1.65% rate. Therefore, the group aiming for a blood pressure below 120 millimeters of mercury experienced fewer cardiovascular consequences. However, this group had a higher incidence of certain adverse effects, such as hypotension, acute kidney injury, and electrolyte imbalance. These side effects are particularly concerning for older adults, who are more prone to falls and kidney problems. CHRT study. Another perspective. Let's talk about another study, the CHRT study from 2021, which analyzed nearly 20,000 Chinese adults aged 60 to 80. They compared the results of intensive treatment to achieve a systolic target below 130 millimeters of mercury with standard treatment with a systolic target of 150 millimeters of mercury. The results showed that the target below 130 millimeters of mercury significantly reduced the risk of severe cardiovascular events, especially strokes, compared to the more conservative target of below 150 millimeters of mercury. Once again, intensive control reduced overall mortality but significantly increased the risk of hypotension and kidney complications. The SPRINT and CHRT studies demonstrate that more aggressive blood pressure control can yield cardiovascular benefits but with a higher risk of significant side effects. Finding the right numbers for personalized care. If you're over 65, what are the appropriate numbers? Individualized treatment is the most common method in the real world. The SPRINT study indicated that a systolic target around 120 millimeters of mercury can help reduce heart disease and strokes, but not everyone can tolerate the medications needed to reach this level. When a person's blood pressure is too low, they may experience dizziness, fatigue, falls, or kidney problems. For some older adults, especially those who are frail, have multiple health conditions, or take multiple medications, it may be more acceptable to aim for a blood pressure below 140 or 150 millimeters of mercury. This slightly higher target can help reduce the risk of hypotension and other negative consequences. Ultimately, it is about finding a balance between preventing catastrophic cardiovascular events and avoiding new health risks, medical side effects, and polypharmacy. Polypharmacy, taking multiple medications simultaneously, is common among older adults. If you already have prescriptions for diabetes, high cholesterol, arthritis, or other chronic conditions, taking stronger or additional blood pressure medications can increase the risk of drug interactions and side effects. Common side effects of blood pressure medications include dizziness, nausea, and digestive difficulties. Common side effects of ACE inhibitors include fatigue or weakness, cough, swelling in the ankles or feet, and kidney function problems. Therefore, controlling blood pressure is not just about following a number. It is also about determining if you can handle the medication burden without sacrificing your quality of life. Lifestyle modifications and non-pharmacological approaches. While medications play an important role, it is also crucial to remember that lifestyle changes are equally important for controlling blood pressure, often more than we think. These include a balanced diet, including fruits, vegetables, whole grains, and lean protein helps control blood pressure. The DASH, dietary approaches to stop hypertension diet, which focuses on reducing salt and eating nutrient-rich foods, has been shown to benefit people of all ages. Reducing salt intake helps lower blood pressure in older adults. This includes reducing the consumption of processed foods, canned soups, and using less table salt. Regular exercise, walking, swimming, or light aerobic exercises help reduce blood pressure. You don't need to do intense workouts. Even modest and regular exercise can be beneficial. Maintaining a healthy weight. Losing excess weight can be beneficial. Each pound lost can lower blood pressure and ease the heart's workload. Limiting alcohol consumption. Excessive alcohol intake can increase blood pressure. If you drink, do so in moderation. 1 standard drink per day for women and 2 for men, although standards may vary. Stress management. Chronic stress can lead to high blood pressure. Meditation, deep breathing, and a little yoga can help relax the body and mind. All these methods can reduce the amount of medication needed or lower the doses required to maintain your blood pressure at a healthy level. Proper blood pressure measurement. Another essential consideration is how and when to measure your blood pressure. In clinical settings, guidelines and studies often emphasize standardized measurements, while home evaluations can provide a more realistic picture of what happens daily. Here are some tips. Take your measurements at regular times of the day, for example, before breakfast or before taking medication. Sit quietly for 5 minutes with your feet on the floor and your back supported. Use a properly calibrated home monitor. Take 2 or 3 measurements with a minute in between and average the results. Some older adults develop white coat hypertension, high values only in the clinic due to anxiety, or masked hypertension, normal values in the clinic but high at home. A home blood pressure monitor can help detect these situations and provide a more complete picture of your blood pressure. When blood pressure is too high or too low, we do not recommend letting your blood pressure reach dangerously high levels. If your systolic blood pressure, upper number, is consistently above 170 millimeters of mercury, or your diastolic blood pressure, lower number, is above 100 millimeters of mercury, you are in a category where most people should reduce their blood pressure with medication. If you have such high values and symptoms like severe headaches, chest discomfort, difficulty breathing, or confusion, you may be experiencing a hypertensive crisis and should consult a doctor immediately. On the other hand, if you start feeling dizzy or frequently feel tired, check if your blood pressure is too low, especially if it is in the range of 90/60 millimeters of mercury or lower. Sometimes, well-intentioned vigorous treatment can cause hypotension, which can be equally dangerous, especially for older adults who are more prone to falls. Working with your doctor. The fact is that each of us is unique, with different medical histories and situations. Therefore, it is crucial to work closely with a doctor who knows your entire medical history, your medications, and any side effects you may experience. Their judgment is more important than any general rule. Talk to your doctor about your specific health goals, especially if you prefer to feel energetic and mobile rather than having rigid systolic numbers. Tolerance to adverse effects. Are you willing to tolerate mild dizziness or fatigue if it helps reduce your risk of a stroke? Consider adjusting the dose or type of medication to reduce side effects. Consider lifestyle adjustments, such as exercise, nutrition, or stress reduction measures, to lower your numbers naturally. A personalized and nuanced approach ensures that you are an active participant in your own health plan rather than a statistic in a massive study. Summary of key conclusions. In 2017, blood pressure guidelines were updated, making 130/80 millimeters of mercury the new hypertension threshold for all individuals, including those over 65. While studies like SPRINT and CHRT suggest the benefits of strict blood pressure control, they also highlight potential dangers, particularly among older adults. For some older adults, it may be safer to aim for a blood pressure below 140 or even 150 due to age-related natural changes, rather than reducing it below 120. Although there are concerns about medication side effects and polypharmacy, the cardiovascular benefits of lower blood pressure should be considered. Lifestyle adjustments, such as nutrition, exercise, weight control, salt reduction, moderate alcohol consumption, and stress management, can effectively control blood pressure. Using proper home measurement procedures helps prevent hidden high blood pressure. Instead of adopting a one-size-fits-all strategy, work with your doctor to develop a balanced and personalized plan. Remember that the benefits of maintaining your blood pressure at 120 millimeters of mercury or less do not necessarily outweigh the physical, mental, or emotional costs and sacrifices, especially if you are experiencing severe side effects. However, do not ignore extremely high values, such as systolic levels above 170 millimeters of mercury or diastolic levels above 100 millimeters of mercury, as they can expose you to significant health problems. The key is balance and personalized care. Talk openly with your doctor about the negative effects you are experiencing and ask if a slightly higher target might be better in your case. Generally, it is better to make these decisions with a comprehensive understanding of your health rather than following a rigid rule. If you found this video helpful, like it and consider subscribing to our channel for more health-related content. Thank you for watching and take care of your heart at any age.